All right. Well, thank you so much for coming to this Medicare 101. My name is Jody Delcier. I'm the SHEBA coordinator for all of Lane County, Oregon, which means I administer the program that helps people with their Medicare questions. Currently, we're recording this and delivering this presentation in December of 2023. And the information in this presentation is going to be good for 2024. So we're not talking about the numbers and benefits and costs for this year. We're looking into next year. This presentation is good for people who are new to Medicare, who are looking for a refresher, who are friends and family members of people who are on Medicare, basically covers the basics. So that's kind of what we'll be discussing over the next couple of hours. Who am I? Why am I here? SHEBA is a program called Senior Health Insurance Benefits Assistance. It's a free program that provides Medicare counseling and advocacy to beneficiaries, their loved ones, or just anyone with questions. We're sponsored by grants and federal funding, which means we're not associated with any kind of insurance company. We don't have any financial incentive to push you one way or another. There's me, the coordinator, and then there are a handful of volunteers who help with your questions, but we don't have a horse in the race. We up front receive about 40 or more hours of training in Medicare topics, and then 12 more hours of training annually. So we stay on top of the latest and greatest in Medicare. And I wear a Willamette logo because Willamette is the sponsor of Lane County, which means that they employ me and they provide office space and materials and printing and mailing and all of that good stuff so that the program can run in Lane County. So what we do, we provide comprehensive information about Medicare and related health insurance. We can help you analyze plans and supplements to see which might be good for your life and needs. We can connect you to computer-based and community resources that can help meet your unique needs. And we can process enrollments specifically for Part C Medicare Advantage and Part D prescription drug plans. We can help you sign up for those if you need to. Some things that we're covering today on our agenda. What is Medicare? When should I be thinking about Medicare? What are the different parts, A, B, C, and D, you might hear about? Then we'll take a little bit of a breather. Then we'll talk about the different Medicare pathways that you can take. Now, pathways is not a technical term. It's just how I frame the decisions that you can make as you go along your Medicare journey. Talk about a few financial assistance programs, some common scams to look out for, and then hopefully we'll have time at the end for a bit of a Q&A, or if there aren't that many questions, I can do a bit of a demonstration of Medicare.gov to show you some of the features that are on there if you want to use a computer and do some looking things up on your own. We're talking basics today. For questions that are pertaining to the current slide we're on, feel free to raise your hand and I can answer your question. If you have more detailed questions, we can wait to the end for the Q&A. That would be ideal. And then if you have questions about your own unique situation, I might be able to stay afterwards and talk to you a little bit, or you can grab my business card and I can give you a call next week and we can talk through your questions. Okay, so what is Medicare? You might notice or recognize this red, white, and blue Medicare card. You might have one in your wallet or at home. It is a health insurance program. Social Security will enroll you in it, typically when you turn 65, although we'll talk about different enrollment times in a minute. It's administered by the Center for Medicare and Medicaid Services, also known as CMS. So if you're getting mail from the Social Security Administration or CMS, you'll know that that's legitimate for Medicare. Medicaid is a separate program. There are some people who qualify for both Medicare and Medicaid, but right now we're talking about Medicare. And in fact, SHEBA is all about Medicare. But when it comes to Medicaid, we're very limited on our knowledge and typically we'll refer you to a different agency. So Medicare questions, we can totally help. Medicaid questions, we'll find you someone who can help. There are 4 parts to Medicare. Part A, inpatient hospital insurance. Part B, medical services and supplies. Part C, Medicare Advantage, which is privately managed insurance. And Part D, prescription drug insurance. And we're going to go into detail about all 4 of these parts and some other stuff. But I just want you to have an understanding of A, B, C, and D as vocabulary going forward. Okay. Let's do this. So first order of business is when should I be thinking about Medicare? four main situations. When you're turning 65, that's when people are automatically enrolled into Medicare. When you're under 65 and receiving Social Security disability, when you have a big life change like retiring or moving, and during annual enrollment times. So those first two bullet points is when you might be enrolling in Medicare for the first time. The second two bullet points are when you should be thinking about Medicare during life's journey. So let's talk about enrolling at age 65. Most people start at Medicare at age 65 during what's called their initial enrollment period, or IEP for short. It lasts for 7 months. So it starts the 3 months before your 65th birthday month, continues your 65th birthday month, and then 3 months following the month that you turn 65. So if you sign up or are automatically enrolled before your 65th birthday month, then the coverage will start on the first day of your 65th birthday month. If you sign up during or after, Medicare will start on the first day, or the first day of the first month following the month you signed up. So let's try to make that a little bit clearer with an example in a moment. If you're already drawing Social Security 4 months before you turn 65, you'll be automatically enrolled. Social Security will mail you a welcome package about 3 months before your Medicare coverage starts. So at the beginning of that initial enrollment period, you'll get a big piece of mail from Social Security saying, "Hi, congratulations, you have Medicare. Here's what that means, and here's your Medicare card." If you're not drawing Social Security before you're turning 65, then you need to get in touch with Social Security to sign up. And I'll provide that phone number for you in a bit. So here's an example to kind of hopefully make it all clear. Daniel turned 65 on April 5th. He's signing up during his initial enrollment period, which runs from January through July. So 3 months before April, 3 months after April. So if Daniel enrolls in Medicare in February, does anyone know when will his coverage begin? April 1st, that's right. So the first day of his birthday month, which is April, since his birthday is April 5th. So let's say he enrolls after his birthday in May. When would his coverage begin? It would begin June 1st. So the first day of the month after he signs up. So let's say you're under 65, but you're getting benefits from Social Security because of a disability. Social Security already knows who you are. They'll automatically enroll you in Medicare. This happens on the 25th month after you start receiving Social Security benefits. So you get that disability, and then 2 years later, you're automatically enrolled in Medicare. And again, Social Security will mail you that welcome package about 3 months before your Medicare is scheduled to begin. So Steve began receiving disability benefits from Social Security in March of 2023. When will his Medicare coverage begin?
March 25?
April 25, so the 25th month. Yep, but good, that was a good guess. And then when would he get his welcome packet with his Medicare card? Be 3 months before that in January. And if he doesn't get it in January 2025, he should call Social Security and say, "Hey, what's up? Where's my Medicare stuff?" One thing that isn't in the presentation that I should note is that sometimes when people get their disability, Social Security says, "You should have been on disability for the last couple of years, so we're going to advance the time that you would be getting on Medicare." So your disability qualification began 2 years ago. So now that you're finally getting that disability, you can start Medicare now. So that might be a factor if you were someone you know is new to disability. Okay, let's talk about enrolling when you retire. So if you or your spouse is working after you turn 65, then it might be a little bit different for how you sign up or whether you have to sign up right away. So if your employer provides group health insurance or your spouse's, you can usually wait to lose that insurance before you sign up for Medicare, specifically Part B, medical services and supplies, and Part D, prescription drug coverage, because that group of health insurance that you get through the employer is covering the same things to an equal extent that Medicare would be. So in that case, you might sign up for Part A hospital insurance at 65, but you wouldn't necessarily need to sign up for Part B or Part D right away. The best way to know if this applies to you is to check with your HR department or your spouse's HR department to say, hey, I'm turning 65. I have this insurance. Do I need Medicare right now? So Jan and Frank are married. Frank is 64 and retired. Jan is 64 is 64 and working. They're both covered by Jan's employer health insurance. Do they need to sign up for Medicare right away? I'm seeing some head shakes. They should enroll in Part A hospital insurance at age 65. And that's because for most people, Part A doesn't have a premium, so they won't have to pay anything to have it. And by that point, that means they'll be engaged in Social Security system. They'll have, some of their Medicare. They'll have that hospital insurance as backup if they need it, but they don't need to enroll in any other parts of Medicare until Jan retires and loses that group health insurance. That's when they'd start thinking about Medicare, Part B and B. B as in boy and D as in dog. Okay, so that's kind of those situations when you would sign up for Medicare for the first time. There are a number of life changes that you might have that would also necessitate you thinking about Medicare and whether it needs to be changing for you. So that's those life changes qualify you for what's called a special enrollment period. For example, you change where you live. Maybe you move from Oregon to Washington or Florida or wherever. If you were incarcerated and you're released, if you lose your current coverage for some reason, like your employer health insurance, as we mentioned when you retire, or your Medicaid, if you lose one of those, you should be thinking about changing your Medicare. If you have a chance to get other coverage, maybe, something new happens and you have a chance to get new coverage. Maybe you get a new job that has employer insurance, you would be thinking about changing your Medicare. If your current plan changes its contract with Medicare and several other circumstances, there's a whole big list over on Medicare.gov. If you search for special enrollment periods, or you can talk to Sheba to say, hey, this thing in my life is changing. Does this qualify me for a special enrollment period? Should I be thinking about changing up my Medicare? We can help you figure that out. And then lastly, you could think about switching your Medicare during an open enrollment period. There are a couple of them throughout the year. You might know that one of them just ended yesterday. So a couple specific times a year, October 15th through December 7th every year is the annual election period, AEP, otherwise known as open enrollment. You probably got a lot of mail, a lot of TV commercials, other notifications saying it's open enrollment, you should change your plan now. A lot of advertising happens during that window. During that time, you can change your Part C Medicare Advantage or Part D prescription drug plans. You're typically not thinking about changing your Part A and B during open enrollment. Another enrollment time is January 1st through March 31st, which is specifically Medicare Advantage open enrollment period. So that's for people who already have a Part C Medicare Advantage and they want to explore options. So that's coming up. If somebody missed their window during open enrollment and they're thinking, I really do want to change my Medicare Advantage plan, there's another opportunity coming up here soon. So Bradley has already signed up for Medicare A, B, and D. He does not have a Part C Medicare Advantage plan, but he wants to consider switching his Part D prescription drug plan. When can he do that? No? Exactly. October 15th through December 7th during that annual election period. He could also change if he has a special enrollment period. Okay. That's when you should be thinking about Medicare. Any questions about those time periods or anything to do with that? I'll take a quick sip. All right, now let's go in depth about the different parts of Medicare A, B, C, and D, and I'll also talk about Medigap. If you've heard of Medigaps, we'll go into those. So like I said, Part A, inpatient hospital insurance, Part B, medical services and supplies, Part C is Medicare Advantage, and Part D is prescription drug insurance. Start with Part A, hospital insurance. So when would you sign up for that? This will be a little bit of review from the last section. It's when you turn 65, whether or not you retire. When you've been receiving Social Security disability benefits for 24 months, it would start on the 25th month. If you are drawing Social Security, you will be signed up for this automatically. If you are not drawing Social Security, you'll need to call them to sign up. It covers Mostly inpatient hospital care. So you land in the hospital, your doctor says you're going to be here a few days as an inpatient. That's when your Part A would be in effect. If you're accessing skilled nursing facility care, nursing home care, hospice care, home health care, and a number of other situations, you can, as always, check Medicare.gov, search for Part A coverage, or talk to Sheba for more details. But the best way to find out, is Part A covering this, is to talk to your provider or their billing office. So, Part A benefit period. So the way that Part A is billed is not annually, but by a benefit period, which begins the day that you're admitted to the hospital as an inpatient, and then it ends after you haven't had any inpatient care for 60 days in a row. So, first of all, you'll need to pay the deductible, which is in 2024, $1,632. Once you've paid that deductible, for the first 60 days that you're in the hospital, a little background, I still try to speak up. For the first 60 days that you're in the hospital, after you're done with the deductible, Part A covers everything. It's $0. If you stay longer than 60 days, from days 61 through 90, you're responsible for a $408 copayment. And then once you hit 91 days, you start using what's called your lifetime reserve days. Through the course of your life, you have 60 lifetime reserve days, which you dip into every time you're in the hospital longer than 90 days. So you don't have to think about it unless you've been in the hospital longer than 90 days. For days 91 through 150, you're responsible for a $816 copayment. And then after day 150, or after you've used all the lifetime reserve days, you pay all costs. So go with an example in a minute to help you figure out that math. So there are some separate amounts for skilled nursing stays, home health care, and hospice care, but mostly just today we're talking about inpatient hospital care. So let me think about that for a bit. So let's say you're in the hospital and you're there for 92 days. That means you've used 2 of your lifetime reserve days. So the following time you're in the hospital and you're there 94 days, that means you've used 6 of your lifetime reserve days. So those lifetime reserve days apply from hospital to hospital visit. They kind of accumulate until you're all out of them. Then once you're all out of them, then you pay all costs. So Teresa's in the hospital. Her doctor tells her that she's receiving inpatient care. She's in the hospital for 61 days. How much can she expect to pay? She'll start by paying her $1,632 deductible. Then she'll have a $408 copayment for day 61 for a total of $2,040 for the hospital stay. That's kind of how the math works out. Okay, so that's Part A. Any thoughts about Part A? Any questions before we move on to Part B? I see a question.
Did Part A cover ER?
Does Part A cover emergency room visits? No, that would be Part B, medical services and supplies, because Part A covers inpatient hospital stays. I want to double check that because I have a little bit of foggy brain, but I think that your Medicare guide should confirm that, and I'll also confirm it during break. All right, Part B, medical insurance. When do you sign up? Again, this will be a review. When you turn 65, when you retire, you can delay signing up for Part B if you have employer group health insurance that would cover all of the same things that Medicare does. Also, when you've been receiving Social Security disability benefits for 24 months. If you are drawing Social Security, you'll be signed up for Part B automatically. If you're not drawing Social Security, you'll need to call them to sign up. Is that a question or a stretch? Okay. So Part B is technically optional. Some people might not get Part B because maybe they're getting health services through the VA or another service. If you ask me, should I not get Part B because I have, I'm getting services through VA or something else, I'll probably say there are some risks to delaying your Part B, specifically if you end up needing Part B later, it'll cost you more. You'll have a penalty. And you're kind of limited on the times of year that you can sign up for Part B if you've missed your initial enrollment period or that special enrollment period from when you retire. So because I'm a risk averse person, would say better safe than sorry and get the Part B. But some people make the decision to defer it because it is technically optional. So I'll tell you more about the penalties in a little bit. What does it cover? Medically necessary services or supplies that are needed to diagnose or treat your medical condition and meets accepted standards of medical practice. Also preventive services like healthcare that prevents the flu or other illness or detects it at an early stage when treatment is most likely to work best. Medicare.gov, as always, is a great place to check, or that Medicare New Handbook that is mailed out every year. And again, the best person to tell you that Part B is covering your service is your provider or their billing office. So in 2024, that premium is going to be, or is, if you're listening to this later, the premium in 2024 is $174.70 a month. So that's the amount that's coming out of folks' Social Security checks every month. There are some programs for low-income folks that can cover that $174.70 a month. Those are administered by the state, kind of by their Medicaid office or DHS. And I can tell you about those programs in just a little bit. You also have in 2024 a $248 deductible for the year. So before you get medical services, before Medicare starts paying, you would be paying that deductible of $240. And then after that, you're responsible for a 20% coinsurance for each Medicare covered service or item thereafter. So you pay that $240, and then Medicare starts paying 80% of your bills. There are some services, particularly preventive ones, vaccinations or screenings that Medicare covers entirely. You pay $0 for. Let's do another scenario, my favorite. Okay, Chris was feeling blue, so he made a plan to take care of his mental health. He had a depression screening in January, and then has had 5 therapy sessions since then. Now it's April. The Medicare approved cost for his therapy session is $191 each. So what has Chris paid so far this year? I'm not expecting you to do all this math. But first of all, his premium. It is April, so he's paid his premium for 4 months. That's $174.70, totaling $698.80. Then he's had his depression screening, which is one of those free things that he can have every year. So that's $0. Then he's paid his deductible for therapy. So he's paid $240 for his deductible. And then he's paying 20% of the coinsurance for his therapy after the deductible. So that would be $143. For a total of $1,081.80 is kind of how his bills shake out for this situation. It's kind of how all the math works out. Okay, so I've talked about Part A and Part B. Before we move on, any questions about Part B as in boy? Cool, we'll float on. So you'll see the screen says Part D, which means we're skipping Part C for now. We will come back around to it. It's just that Part C is kind of a slightly different animal. And when we get there, you'll kind of understand why we're doing it in this order. But typically when you get and stick with Part A and B, you'll also be getting Part D together with that. So it'll make sense when we get there, but we're going to just move on to Part D and come back to Part C in a bit. So when do you sign up for a Part D prescription drug plan? Again, this will sound familiar when you turn 65, when you retire, when you've been receiving Social Security benefits, during certain special enrollment periods. You can also change your Part D during open enrollment. And again, Part D, similar to Part B, is technically optional, but again, you'll face penalties if you put it off. So again, some people get their medications covered by some other service. And so they'll say, I don't want or need to pay for Part D. That's a choice that you could make. Again, like I said, I'm risk averse, so I would say sign up for it, especially because there are some zero premium Part D plans now in Lane County that If you sign up for them and never use it, you're not paying anything. Okay, so we'll loop back to penalties in a bit. But what does it cover? All plans must cover a range of prescription drugs that people with Medicare take. After that, each plan has its own what's called a formulary or list of covered drugs. So some prescription drug plans might cover a drug really well. Some might not cover it at all. And that's why it's important to evaluate it every year and decide whether it still fits well for the prescriptions that you're taking. So the formularies, the drug lists, are organized into pricing tiers. Each tier has a different copayment. So the tier 1 is going to be the cheapest prescription drugs, generics, the lowest copayment. Sometimes it's a $0 copayment. A tier 2 is going to have a medium copayment with more preferred brand names, and then so on, higher copayments, higher brand names, up until tier 4 or 5, depending on the drug plan. I guess it makes sense that more expensive brand name drugs will be in a higher tier. What does it cost? The monthly premium varies by plan and county. There's one as of 2024 in Lane County that's a $0 premium. And so, like I said before, if you aren't currently taking any prescriptions, but you think you might need to, or you want to just have that as an option, there's a 0 premium option. It can range and be much higher for lower deductible plans, up to $127 a month. Personally, I've never worked with somebody who has that high of a premium plan. Usually there's a in-between amount that has a plan that has the best coverage for their needs. Then after the premium, you're also thinking about a deductible up to $545 in 2024. Now, each plan can have sorry, again, a bit of background noise, I'll try to be loud. Deductibles can range. Some plans have $0 deductible, some have up to $545, some are somewhere in between. Just depends on the plan that you pick. And if you're using the Medicare Plan Finder, it will do all of the math for you to calculate how much your prescriptions are going to cost, how much your premiums are going to cost, how much your deductible will cost, so you have a clear picture of what you can expect. And if you're not comfortable with computers, that's where Sheba can help. And then again, copayments and coinsurances vary by plan, where your drug falls on the tier list, whether your drug is covered in their formulary. It's a lot more nebulous than with A and B. So the way that I like to think about the costs that you'll be paying throughout the year for your Part D prescription drug plan is in phases. The first phase is the deductible. If you have a prescription drug plan with a deductible, you have to pay that first, 100% of that amount. So up to $545 if it does have a deductible. After you've paid that deductible, you're in your initial benefit period, which means that you pay the amount specified by your prescription drug plan's tier list. So you have one tier 2 drug that costs you $12 a refill. That's the amount that your prescription drug plan says that you'll pay for it. You're paying that $12 for every refill up until both you and your plan pay together $5,030. If you don't reach that $5,030 by the end of your year, then you're just in the initial benefit period the whole year. If you have some expensive drugs, that's when you're thinking about going into the donut hole. Womp womp. It's womp womp is kind of almost an insensitive way of putting it, because it does put people in a lot of financial stress often. It's where instead of paying that $12 or whatever your tier 2 drug is, you're starting to pay 25% of the total drug cost, which might be a lot more. So if you have a $100 drug that you've been paying $12 for, and then suddenly it goes up to $25, that can cause a bit of financial stress. All of a sudden your bills are going up while you're in the donut hole. So if you hear people talking about donut hole and how it's causing, oh, my drug prices just went way up in the middle of the year, yikes. That's kind of what they're talking about. And that donut hole, you're in that phase until your total deductible and prescription costs add up to $8,000. After you make it out of the donut hole, which about 2 or 3% of Medicare beneficiaries might every year, That's when you get into catastrophic coverage and Medicare will pay all of the remaining prescription costs throughout the rest of the year. New in 2024 used to be that you would be paying 5%. Now it's gone to 0%. You're not paying anything. So those are the phases of your prescription drug plan benefit. Okay. Any questions before we move on to Medigaps? Okay. So again, we will come back to Part C, but when you're thinking about going the route of Medicare where you're taking A, B, and D, Medigap is also an option kind of for this group of people. So what is a Medigap? It's a additional supplemental insurance that you buy to go along with your A, B, and D. You'd sign up for it during your Medigap open enrollment period, which starts the month that you start Part B and you're 65 or older. So it's not necessarily when you turn 65, because if you retire and you didn't get Part B when you turn 65, if you retire, that's when your Medigap enrollment period would start. So both conditions are met. That's what starts your Medigap open enrollment period. During that time, you can buy any Medigap policy sold in your state, even if you have health problems. So any chronic illness, you have what's called guaranteed issue. They will sell you that plan regardless. You can change Medigaps. If you already have a Medigap, you can change from year to year on your birthday, and 30 days later, and you'll have guaranteed approval for an equal or lesser plan. So if you have a Medigap Plan G, you can switch to another Plan G or a B or C. I'll tell you more about those in a minute. But you can change from year to year if you'd like. If there's a different plan that is less expensive, you can kind of move around from year to year. If you're not getting a Medigap when you're first eligible or around your birthday time, there's no guarantee that a insurance company would sell you a Medigap policy. They'd put you through medical underwriting or medical review. You'd have to fill out a survey that says these are my current conditions or these are my most recent conditions. And they might be able to look at that and say, we won't sell it to you because we think you might, be too risky and too expensive for us to cover. They might say we're going to delay until some of your medical issues have resolved, or they might say we're going to make this a lot more expensive than you thought it was going to be. Medigap is completely optional. If you choose to enroll, you need to have A and B first. So what exactly does Medigap cover? The gaps in original Medicare, which is the 20% co-insurance that you'd be paying on your Part B services and supplies, the co-payments for like your hospital stays, deductibles, etc. There are 10 standardized policies in most states which have varying levels of benefits. So what will a Medigap pay for kind of varies from plan to plan. Medigaps are sold by private companies, so AARP, for example, or United Healthcare or Moda or various insurance companies will be selling that Medigap, but each plan must meet the same requirements. So if you have a Plan A Medigap with one company, it's going to cover the same things as a Plan A with any other company. The only difference really is the price and pricing model. What does it cost? Well, the companies will charge different premiums for the exact same policy, which is why if you have one, it's nice to look around your birthday every year to see if there's a less expensive option. A few different pricing models. Some are community rated, which means that everyone with that plan pays the same premium. The cost sharing is distributed, so the younger people might pay more than average, the older people might pay less than average. This is community rated. Issue age rated is a model where when you sign up, you are paying the rate for that age person for as long as you have that plan. So you sign up when you turn 65. By the time you're 75, you're still paying that 65-year-old's rate. And then attained age rated, which is the most common, is the rate goes up every year as you get older. Now, with issue age rated, I say that you're paying the 65-year-olds rate every year. That doesn't mean you're paying the amount that you started paying. It means that whatever 65-year-olds are paying that year, that's what you're paying. So if it goes up based on inflation or something, that would be still something that you would have to, the price would still be going up for you, but it would be you paying the 65-year-olds rate rather than the 75-year-olds rate. You can compare policies on Medicare.gov. They have a decent search tool to compare Medigap prices, taking into account your age, gender, and tobacco use. Medigap prices fluctuate pretty often, though, and so Medicare.gov might not always be the most up-to-date. At Sheba, we have a kind of special search tool that's a little bit more accurate to the day. So if you want the most accurate pricing, you can always get in touch with us and we'll run a quote for you. However, we're not able to sign you up for a Medigap, so from there we would hand you off to a licensed insurance agent who could help you sign up. So that's Medigap. Any questions about Medigap before we move on to Medicare Advantage? Okay. I should say pricing in Lane County. It's generally accepted for new Medicare beneficiaries that a Plan G is going to be the most comprehensive, quote unquote, best plan for Medigap that there is. And ballpark, if you're new and 65 and don't smoke, you can ballpark about $150 a month for a Medigap. But again, it varies. If you like peace of mind and you think, well, I don't know when I'm going to land in the hospital, or I have chronic conditions and I go to the doctor a lot, and $150 a month sounds a lot less than what I'd be paying for copayments and coinsurance. That's sort of the thinking behind getting a Medigap. I'll go into that some more as we talk about Medicare pathways. Okay, now let's finally loop back to Part C as promised and talk about Medicare Advantage. So when would you sign up for that? Is when you have both Part A and Part B. So that could be when you first enroll in Medicare at 65, when you retire, when you get A and B from being on Social Security disability. Whenever you have both Part A and B, that's when you can get Medicare Advantage Part C. You can also get it during special enrollment periods. You can change to and from Part C during open enrollment and Medicare Advantage open enrollment. It is completely optional. You don't have to get a Medicare Advantage plan if you don't want to. What does it cover? Must cover at least everything that is covered by Part A and B. All of those same services, supplies, and hospital benefits must be covered by Part C. They also usually cover Part D. There are some Medicare Advantage plans that have prescription drug coverage, others that don't. The ones that don't, maybe if somebody gets their prescriptions covered by the VA and they want a Medicare Advantage, in addition to that, that might be why they go for a no prescription Part C. There may also be additional benefits not covered by A and B if you go with a Medicare Advantage, such as hearing, dental, vision, and fitness. Those vary based on plan. They might have it, they might not have it. There are also Medicare Advantage special needs plans that provide specialized benefits for a few different groups of people. For starters, those who have both Medicare and Medicaid are eligible for a special kind of Medicare Advantage plan called a dual plan or DSNP. Those with certain chronic conditions might be eligible for a C-SNP or a chronic special need plan. And those who are in medical institutions might be qualified for an institutional special needs plan or I-SNP. What does it cost? Well, you're still paying your Part B premium. So it's not like your Part B premium goes away if you choose Medicare Advantage. You're still paying $174.70 a month in 2024. Then there are some Medicare Advantage plans that don't have a premium, some that do. So it varies by plan. Deductibles, again, vary by plan. Co-payments and co-insurances for various services and supplies vary by plan. It's all, there's a lot of different offers out there. There are some cases where the services and supplies that you'd be going with for Medicare Advantage are more expensive than without a Medicare Advantage, some that make things less expensive. I'll go into details about pros and cons in a little bit. Medicare Advantage is good for some people. Original Medicare Advantage is good for some people. It's not my business to drive you in one direction or another. Let's do a little test your knowledge about A, B, C, and D. Which part of Medicare covers durable Medicare equipment like walkers and canes?
B.
It'd be B as in boy. How about your inpatient hospital stay? That's right, part A. Which part would cover a blood pressure medication that you would pick up at a pharmacy? B, your prescription drug plan. How about dental? Part C might have some benefit depending on the plan. Medicare A and B don't cover dental at all. So if you're looking for dental, you'd either be looking at a Part C Medicare Advantage or getting a standalone dental plan. How about flu shots? Oop, I might have spoiled it. Anyone see that? Flu shots, Part B. How about skilled nursing facilities? That's right, it's Part A. And then fitness memberships. That's right, Part C Medicare Advantage may have some benefit depending on the plan. Most of the plans in Lane County do have some fitness membership benefit. Okay, let's talk about late enrollment penalties. So like I said, Part B and Part D are technically optional. If you don't sign up during your initial enrollment period or a special enrollment period like retirement, you'll be subject to penalties for the time that you could have signed up but didn't. So for Part B, that's 10% per year that you could have signed up but didn't. For Part D, that's 1% for each month of kind of the benchmark amount. So for example, Nancy turned 65 in 2021 and then waited 2 full years to sign up for Part B. She didn't qualify for a special enrollment period like retirement, so what does she have to pay each month 2024? So that means she was eligible in 2021, signed up in 2023, but she does have that lifetime 2-year penalty. So what is she paying every month in 2024? I won't make you do math. The standard Part B premium for, I have a typo there. It should be 2024, is $174.70, and she's paying 20% of that extra, so $34.94. And then it's rounded, so she'd be paying $209.60 a month in 2024. So $35 a month ain't nothing. It's meaningful. So definitely, if you're eligible for Part B and you think you're going to need it, that's why I kind of strongly say avoid that penalty because it does follow you for life. The question is, if you qualify for a special enrollment event, do you have a penalty? It would be something like retirement, where you say, I have creditable coverage for Part B through my employer health insurance or through my other health insurance. My Part B needs are covered and I have the paperwork to back that up, so I'm going to defer Part B. And then when you lose that insurance, you have that special enrollment period. You won't be subject to penalty from there. You'll just get the standard, regular, no penalty Part B premium.
How does a termination have that same coverage as retirement? It's a special situation.
The question is, I'm just repeating for our computer audience, is would a termination, like somebody is fired, does that have the same circumstance as retirement? Yes, if you lose your employer health coverage for any reason, really. We like to say retirement just because usually you have a few months notice before you retire. But yeah, if you lose your employer health coverage and you're thinking, okay, now's the time to sign up for Part B, you'd still want to work with your HR department or former HR department to figure out that paperwork. But really, it's you're over 65, you lose your employer health insurance. I'm sorry. Uh, the answer is yes, that is the same situation. We are now ready to have a little break, a little less than halfway through. So I want to give us, I don't know, 5-10 minutes to refill our water bottles or do whatever we need to do. I'm going to go ahead and put our recording on mute. If you have any questions that you want to talk about, I'm here for a few minutes. All right, let's get back to it. So now let's dive into Medicare pathways. Now, pathways, as I said before, is not a technical term, and it's just what I say when talking about what are the different Medicare choices that you can make. The first path that you can take is going with original Medicare. That's where Medicare, the federal program, is your primary insurance. You're using Part A for hospital, Part B for medical. You're getting your drugs covered through a prescription drug plan or Part D. And then from there, optionally, you can have secondary insurance to cover out-of-pocket costs, such as Medigap, or if you have Medicaid, that's an option to cover your out-of-pocket costs. So original Medicare, or using the federal government program. Why might you go that direction? Well, it's flexible. You can see any provider that accepts original Medicare. If you can get on their client list, then you're good to go. And a lot of providers do. About 95% of providers will accept original Medicare. This is across the country. So if you travel, or maybe you have a home here and a home across the country, or you spend several months out of the year with your kid in New York, Medicare can cover services for you across the country without being limited to a provider network that's regional. It's also stable. There are fewer surprise charges or changes in coverage with original Medicare. You can be pretty sure that if you're going to a specialist, you're going to be paying 20% of that bill. Kind of a subpath of that is going with original Medicare plus Medigap. Why might you choose to add a Medigap? Because it could limit your out-of-pocket costs. Medigap's cover deductibles, co-payments, and co-insurance. So those hospital bills, those 20% co-insurances, if you're worried about those adding up, or you're worried about having a big surprise bill dropped in your lap, and you'd rather have the consistency of paying $150 a month or whatever it is, that might be appealing for getting a Medigap. And this is redundant, but yeah, predictability, you can consider it more like a healthcare subscription rather than a pay-as-you-go model. You know that by paying that extra Medigap amount, you have all of your health needs will be covered. And then peace of mind. So it can cover unexpected healthcare costs as they arise. So hospital bill, new condition, lots of tests. Medigap can provide that peace of mind. Next path you can take is going the Medicare Advantage route. So you must be enrolled in both Part A and Part B to get Medicare Advantage, as I mentioned before. And this is where Medicare will have a private insurance company, think Providence, Pacific Source, Moda, United Healthcare. One of those private insurance companies will manage your Medicare benefits instead of Medicare managing them. Why might you go that direction? There are often some additional benefits like vision, dental, hearing, and wellness or fitness programs. If you don't expect to go to the doctor as much, then Medicare Advantage can be seen as a less expensive or more cost-effective option. You could have a lower premium for like a zero premium Medicare Advantage plan and then pay as you go with co-payments and co-insurances. And if you're somebody who doesn't want to manage upkeep on, for example, your Part A and B, your Part D, your dental, your vision, your fitness membership, if you prefer the convenience of having it all in one place, Medicare Advantage can kind of have that all in a single plan for you. So folks who might get really easily overwhelmed or try to do it all on their own can find that that is really appealing for them. So I'll give you a few examples of people who might be considering their path, and then let's talk about what path might work best for them. So Craig is a retired pilot who enjoys traveling around the country in his RV. He wants to see any healthcare provider who accepts Medicare, regardless of where he is located. Craig is generally healthy, but has some chronic health conditions that require him to see specialists occasionally, and he has a few prescriptions. So what path might Craig consider? Yeah? Yeah, so one of our audience members says original Medicare because of his traveling. And if I was talking to Craig, I'd say, yeah, I mean, that's really important. And if you get a Medicare Advantage plan, you're kind of limited to reach a regional network of providers. So Eugene, Springfield area providers, you'll be able to see. But if you're out in Texas in your RV, you would be able to get some emergency services, but you might be more limited on other providers that you're able to see. So original Medicare could be a good fit for his lifestyle, his situation, his health needs. David is a retired mechanic who lives on a fixed income. He's in pretty good shape, doesn't visit the doctor often, but is prone to cavities and visits the dentist regularly. He takes a few generic prescription drugs. What path might be good for David? There's, yeah, so somebody's saying Medicare Advantage because it has dental. It's up to him. Again, at Shiva, we're never in a position of pushing you one way or another, but Medicare Advantage could be a good fit because then he knows, depending on the plan, that he's getting some dental benefit. And then Mary is a retired school teacher who has a few chronic health conditions that require her to see specialists regularly. The out-of-pocket costs for all the specialist visits can add up quickly, especially for hospital visits and other major expenses. She values predictability and having consistent bills. What path might Mary consider?
She is a retired school teacher and might have PERS benefit, which combines well with original Medicare.
Somebody in our audience says she's a retired school teacher, so she might have PERS as an option, which combines with original Medicare. That is a fantastic point, and one that I'm not really factoring in with this example. But yeah, if I were talking to her, I'd say original Medicare plus Medigap, which there is a Medigap PERS option. Could be a good option for her because she's racking up those medical bills. And so if she has a Medicare Advantage and she's seeing a specialist for $30 every visit, that's going to add up. But with a Medigap, she's paying a consistent amount every month. She doesn't have to think about paying a lot of co-payments, co-insurances. I also want to draw your attention that there is something called a Medicare Advantage C-SNP or chronic special needs plan. So depending on her chronic conditions, those are plans that are tailored to meet the needs of certain chronic conditions. So it's worth exploring. But typically, if she has the funds for it, I would say you value peace of mind. You have a lot of monthly expenses. Medigap seems like it could be a good option for you. Would you like to see the options? So ultimately, the path you choose is your call. When you're choosing your path, you'll factor in your lifestyle, your medical needs, your budget, the care providers that you see or want to see, and a lot of other things. There's so much to be thinking about when you're choosing your Medicare path, all when you're turning 65 or all when you're retiring. So it's just a lot to think about at once. So don't be afraid to poke around Medicare.gov or call Sheba to talk things over. Maybe you already have an inkling of what you want to do and you want validation. Maybe you just have no idea where to start. We're here to just help you parse through all of your considerations and see what's going to be the most important factors as you evaluate your pathway. We're here to give you information. We're not here to sell you anything. We'll run plan comparisons. We'll look up prices. We'll look at providers. We'll try to get you figured out. So another quick breath. Any questions when it comes to pathways?
I feel pretty healthy right now, but that doesn't mean in 3 years from now or 5 years from now, or, things can change.
Right. So the comment is that while we know how healthy we are now, we don't know how healthy we'll be in the future. And so it's hard to make a decision now for something that's going to affect you very deeply in the future. I agree with that. Yeah.
Well, but I guess the good thing is that as your needs change, you can re-enroll every year, right? It's something different.
So question is, as your needs change, can you re-enroll into something different every year? And that's the tricky thing is if you go with the Medicare Advantage pathway right away, you have a year to change back. You have a year trial period to see whether you like the Medicare Advantage. And then if you don't, you can switch to original Medicare and a Medigap. But if you wait longer and then you decide later on you want a Medigap, you could be subject to medical underwriting, which is when they look at your whole health history and decide whether they want to take you on.
You really have to make a decision on that.
You do, yeah. Yeah, and so some people can get into a bit of a bind if they do decide that they want a Medigap later. But the alternative might be paying for a Medigap that you're not using. You're paying 150 a month and not getting any medical services and just saying, well, at least I have the peace of mind. It's pretty expensive and it's kind of a gamble and it can get complicated and tricky and it's a hard decision. And I can't sugarcoat that. Yeah.
Well, with Medicare, I call it disadvantage, you can be denied service. Correct? You have an insurance company that will tell you whether or not you can get a procedure or whether they'll pay for something. For Medicare, there's nobody between you and your doctor. Is that correct?
A question is, can Medicare Advantage deny you coverage or deny you services with the insurance company making that decision? They can require prior authorization, yeah. So the private insurance company might be a little bit more involved in those decision-making processes.
And then I'm hearing more and more hospitals and providers that are no longer taking Medicare Advantage at all because of the billing issues and because of the non-payment issue.
Another question or comment is that there are some hospitals and medical facilities that are no longer billing Medicare Advantage because of billing issues. Essentially, is that a good summary? And that is the case currently not in Lane County. There used to be a situation in Lane County or here in Springfield where we have a major hospital that wasn't working with one of the insurance companies. Since then, they've been able to draw up a contract that works. So as I'm talking to people one-on-one, I'll say there aren't any current issues with Medicare Advantage plans and our local regional hospitals. Other places in Oregon, so if you're thinking about moving out to Bend or moving to Portland, there are some issues that you'll have to take into consideration with certain hospitals or medical groups or facilities not working with certain Medicare Advantage programs or any Medicare Advantage programs at all. So like I said, Medicare Advantage limits your provider network. Sometimes that limitation can be pretty severe. So that's definitely something that during a one-on-one appointment, I would be counseling somebody on, hey, you're moving to Portland and Portland area hospitals have issues with X plans. And you're going to really have to factor that in as you make your decision for Medicare. And that does change some people's minds. Yeah. So I've said it before, I'll say it again. I'm not in the business of pushing people one direction or another, but that you bring up a couple of very important points.
Their interest is my health, not their profit. That's my goal. I mean,
Yeah.
I had a dentist.
I want to just remind you that we are recording this and it will be posted on YouTube. So I just want to make that aware as we talk about our more personal decisions. But feel free.
Got identified, so I'm.
Sure. Yeah, that's fair. That's fair.
Because of the discussion that we're having.
Yeah.
We're doing, a lot of people I talk to do the Medicare Advantage, but it doesn't sound that great.
Yeah. So just for the benefit of our recording and for our time, I'd like to move on to our next section, but then I do encourage some really good discussion among peers to talk about why or why not to go certain directions, I think. And I also appreciate hearing perspectives as they help to inform my counseling.
And we'll have time at the end to kind of
Yeah.
talk more about this.
So, but good points are made. Financial assistance programs. So let's say $174.70 is a lot of money for Part B premium every month, and you're low income and you might qualify for some programs. Let's talk about those. Medicare savings programs is where the state, Oregon, will pay for your Medicare Part B premium. The eligibility is based on your income. So if you are single, your income can be up to $1,660. If you're married, then your combined income would be $2,239 per month. If that sounds like you might be eligible for a Medicare savings program that pays your Part B premium. There are more programs that could also pay for your deductibles and coinsurance. That is a yet lower income rate. In Lane County, Senior and Disability Services can help determine eligibility and help you to apply. Their phone number is on the screen and also on the back of your SHIBA brochure, I believe. So if you think that that sounds like you call them and you say, "Hi, I'm looking to talk to an eligibility worker to determine whether I am eligible for a Medicare savings program." And they'll connect you with the right people. Another program is limited income subsidy, AKA extra help. And this focuses in on your monthly premium assistance for Part D, as in dog or drug. It reduces the co-payments at the pharmacy to $4.50 for generic drugs or $11.20 for brand name drugs. So you have a $2,000 brand name drug and you are qualified for low income subsidy. This can be a major, major relief. Again, your eligibility is determined by income, but also resources. So any savings accounts that you might have. If you are single and you make less than $1,842 a month, or you're married, you make less than $2,485 a month, you could be eligible. And resources up to $16,660 for singles, $33,240 for couples. So folks saying, I'm very low income, live off of Social Security, don't have anything in savings, this could be a very, very good resource. To do that, you can apply on the Social Security website or talk to the local Social Security office on the phone. Or when you're talking to Senior and Disability Services for the other Medicare savings program, you'll automatically be enrolled in this one as well. So they kind of go together. And for the Eugene area, that's the phone number. So those are a couple of programs that can help folks with low incomes. Like I said, I'm the person to talk to about Medicare, not Medicaid or Medicare savings programs. I like to think of it as in, I'm a sandwich shop, the Medicaid people are a pizza shop, so you can't come to me and ask for pizza. So talk to the pizza people about pizza. Otherwise, I'll still just be directing you there anyway. So let's talk about protecting your Medicare information, avoiding scams, keeping yourself safe from the bad guys. Medicare and SHIBA will never call you unless you call us first. We're not going to cold call you. Particularly, Medicare only communicates by snail mail. So if you get a call from SHIBA, it's because you called us first. So protect your Medicare card like you would protect your credit card information and Social Security card. In fact, you can consider leaving it at home and you're safe unless you're actively going to the doctor, a new doctor, and they require proof of insurance. And say, here's my Medicare card. Whenever you're not in that situation, you can leave it at home. Protect your Medicare number so that nobody can lift it out of your wallet. Some common scams we've been seeing. Somebody offering to laminate your Medicare card. I'll say, hey, you have a plastic or a paper Medicare card, and we live in Oregon. It's wet here. Let me laminate that for you, encase it in plastic. It'll be so nice. You don't have to worry about it. And then come to find their laminator is also a scanner, and they've just scanned your information. Now they have it handy and can use it to defraud you and Medicare. So yikes. Similarly, plastic cards with chips, you might get a phone call that says, hey, Medicare has these new plastic cards to replace your paper one. It has a chip in it. It's easy for a chip reader to read. Do you want one? Or have you gotten yours in the mail yet? You haven't gotten one. Oh no, we got to send one to you right away. Give me your Medicare number. We'll send it to you in the mail. There's no such thing as a plastic Medicare card. So what you've done is just given them your Medicare number. And again, they can use that to defraud you. So don't give out your Medicare number, even if they sound really upbeat and trustworthy. Free COVID test. This is not one that we've been seeing as much lately, but with winter coming back, this might also come back. Maybe you're scrolling on Facebook and you see, hey, give us your Medicare number and we'll send you 4 free COVID tests. There are some legit COVID test offers. The USPS was offering some. That's fantastic. But if there's something that ever seems a little bit sketchy and they're asking for your Medicare number in order to send you tests, often what'll happen is, again, they'll take your number. They might even send you some expired tests in the mail, and then they have your number and can defraud you. So don't put your Medicare number anywhere on the internet. Then aggressive callers. Hey, you're behind on your Medicare payments. We need you to pay up right now or else you're going to go to jail. Give me your Medicare number. Oh, that situation was actually resolved. You're good. Never mind. Bye. That would be an aggressive caller, or even, hey, you're not using all your Medicare benefits. Give me your Medicare number and we'll see what we can do for you. Then they might say, oh, have you realized that you have this Medicare benefit? Did you know that you can get a depression screening? Oh, good. Now you can. Good. And they might just be telling you about regular Medicare benefits that you're not using, but they've now got your Medicare number. What happens when they have your Medicare number, though? There could be a fraudulent doctor's office set up far away, and they start billing medical services and supplies through that doctor's office, charging Medicare 80%, and then you might get a Medicare summary notice in the mail saying you owe 20% on this thing that on this test that you never had, on this supply that you never ordered. But because they were able to bill your Medicare number for that using that fraudulent doctor, you're now in a position of trying to work out with Medicare, hey, that was fraudulent. And that's a whole headache that you want to avoid. So that's why I let you know about these scams, so that you don't give your Medicare number to anyone but your doctor. Or your doctor's office, I should say. Cool. Wish I didn't have to give you that PSA. Wish that it was an honest world out there. But
The back brace one. They call it about back brace all the time.
oh yeah, somebody says we're that there's getting calls about back braces. Yeah, if you don't need one, why are they trying to charge you? Yeah, a doctor would be prescribing that for you. So just beware of scams. I hate that I have to tell people about it, but here we are. Next steps. If you're not on Medicare yet, make a plan for transitioning onto Medicare. You can scope out your options and get your questions answered at medicare.gov. If you're familiar with computers, if you're not comfortable with computers, you can talk to us at Sheba, or if you have a licensed insurance agent who you like and trust, then talk to them about it. Even friends and family can be a good resource for starting your learning journey. When you are getting information about Medicare, get it from an official source. So you can get it from Sheba, you can get it from the Social Security Administration, Medicare, CMS. That Medicare and You handbook that they send out every year is official. That Sheba guide that I brought here to our meeting today is a good official guide. Insurance companies will have a lot of information on their websites, usually leading back to, and here's why you should sign up with us. So just take that with a grain of salt. It might be accurate, it might be reasonable information, but just know that sometimes when you're getting information on the internet or from an insurance agent, they have an incentive to push you one way or another. So just keep that in mind when you're getting that information. Also good to document all your interactions with legal entities and care providers. Save your paperwork somewhere safe. And then if you are thinking you have questions that need answering, here's when to call Sheba. Our Lane County number is 541-736-4421. When you call us, you're going to leave your information in a voicemail. We don't have somebody available to pick up phones all the time because I work 25 hours a week and the rest of everybody on our team is volunteers. So whenever I get a voicemail from you, I'll respond as soon as I can, usually within a couple of business days, to gather all of your information and then hand you off to our next available counselor. So that sounds like something that you want to do. You can get answers about everything we learned in this presentation. What is Medicare? What are A, B, C, and D? How do I get started? What plans are out there? What is the timeline for starting or changing my Medicare plan? Can you help me file an appeal? Maybe a service was denied that really shouldn't have been denied coverage. We're local people. We can typically help you. Like I said, you call us, I'll call you back within a couple of days, and then I'll have a counselor on the case within a week. Usually. Open enrollment is maybe a couple of weeks, but we're past that now. So hopefully within a week, we can be in touch with you. When to call other folks? The Oregon Statewide Sheba office located up in Salem has more staff than we do, although more clients than we do too. Here's the phone number, 800-722-4134. When you call that number, it'll say enter your zip code to be connected to your local office. If you do that, they'll direct you to me and we'll go through the process that I just outlined. But if you want to talk to somebody right away, you have an urgent thing that you're really stressed about, and you were like, Jody seems nice, but she can't help me for a week. So I don't take offense to that. I know kind of the situation that we're in right now. So don't enter your zip code. Let it go through to the next available phone operator. They can help you with your questions. They won't be able to do as local specialized knowledge, but answering your Medicare questions, they're fantastic. Great group of people up in Salem. So yes, that's when you'd be getting help with urgent matters that don't require local knowledge. When you get in touch with the Aging and Disability Resource Connection or Senior and Disability Services Office is when you're applying for Medicaid or other state programs, Medicare savings programs, et cetera, that will help you reduce your prescription and medical costs. And then Veterans Services, if you need help understanding your veterans benefits, that's really not an area of expertise for us at Sheba. And so we'd recommend that you talk to the VA or Veterans Services for that. Okay, now it's time for me to pitch you a little bit. And that's that if you're interested in volunteering as a Sheba counselor, we would absolutely love to talk to you about it. You'd be part of the Lamb volunteer community, providing compassionate help and instant relief to Medicare beneficiaries and their families. There are a few roles. You could be the counselor who talks to people individually, one-on-one, and helps them solve their problems. You could be the intake person who responds to those voicemails, gets all the details, and hands off to a counselor. Or an outreach person giving presentations like this one. I can tell you I've been at this for about a year after several years doing a marketing job. This position and working with Medicare beneficiaries has been a whole kind of game changer for my entire life because I feel like I'm making a difference and helping humans to untangle some of the more stressful problems of their lives. Medical benefits are stressful and personal and often deeply confusing. And so when I'm able to sit with somebody and say, here's a plan that's going to save you a lot of money, or here's an answer that even might not have been what you've been hoping for, but at least you don't have to sit on hold for another 2 hours. You know, I'm able to work with you directly and make your life a bit better. Like really nothing like it. So if you're kind of a service-driven person who likes to solve puzzles and make people's lives better directly and instantly, and you have some volunteer hours that you want to dedicate somewhere, highly recommend getting in touch with me because it's really quite something. So that's the info line number again, if you'd like to get started with us at Sheba, or even if you just want to talk about it. So we are at the end of this Medicare presentation. And if anyone has any kind of general questions that you think would be good for other Oregonians to hear, now's the time to ask them. Otherwise, I'll end the recording and we can talk more personally about your stuff. So any other general questions? Go ahead.
You said on the Sheba website, there was a tool for evaluating Medicare plans. I can't find that. I can only find a PDF that lists a bunch of Medicare providers. Is that what you're talking about?
So the question is, where can I go to get up-to-date pricing for Medigap plans? And so Sheba counselors have a tool that's kind of limited to us. So you'd have to make an appointment with us or send us an email or something to say, can you look up Plan N for a such and such description person, and then I can send you a bunch of quotes, but it's not available to the public. If you do want to look up Medigap pricing, why don't I show you on Medicare.gov? Generally, Medicare.gov is pretty accurate ballpark pricing. It just might not be up to the minute. So you go to Medicare.gov, go to Find Plans Now. Enter your zip code. We're currently in 97477. And then click Medigap policy. We're not looking for either of these. We're looking for Medigap. Find plans. You able to see okay up here? Okay, then we'll take you to the Medigap page. And again, you'll keep that zip code and hit start. Then it'll take you through the different Medigap plan options. And what I like to do first is to look at compare to other plans for this helpful chart. that'll show you what each Medigap plan covers. So as you can see, Medigap Plan F looks like it ticks the most boxes. However, it's not available to people who are newly 65, only people who turned 65 earlier than a couple of years ago. So if you're new to Medigap, then the best, most comprehensive plan you can get is a Plan G. You'll see it pays for Part A co-insurance, hospital costs, Part B co-payments, Part A hospice, everything. Part B excess charges is a question we get often. That's when providers can charge you up to 15% more than the Medicare approved amount and you pay that difference. That's an excess charge that a Medigap would pay for. So that's something that Plan G pays for that nothing else pays for. So that's kind of why some people might go that direction. Other people think, I'm not worried about excess charges and I want a Plan C. Great, we can compare that. So once you've decided which plan you'd like to look into, click out of that. And we can get a more accurate price. Let's say that we're a 65-year-old woman who does not use tobacco. That's going to be probably the least expensive overall profile of a person. You'll update the prices, and each plan will have premiums in a range. Let's say we're looking at Plan G because this person is like, I want to not have to think about anything ever as much as I can. I can appreciate that a bit. You click on View Policies. And the least expensive option right now, Manhattan Life. It has an attained age pricing model, which, as I mentioned before, is where the price goes up as you age. I found that how do I put this? Attained age pricing means that you have lower payments upfront, higher payments as you get older, and about evens out around 75. So if you start off with something like a more expensive issue age pricing like Everence, for example, and it's 155 to start out, again, it balances out around age 75. Last time I did the math, which was probably a few months ago. So take that with a grain of salt, but there are reasons why you might go with issue age rather than attained age.
And that means it stops at 75?
Oh, sorry, that's a great question. So it doesn't stop at 75. It's kind of when the average balances out.
That price.
Yeah, so kind of on average, you're spending less when you turn 65, way less when you're 65 and way more than when you're 85. As if you go with,
No, it makes sense what you're saying.
Yeah. So if you go with an attained age, it might be more expensive up front, but it's more level throughout the rest of your life.
That makes sense.
Yeah. So that's how you can find some pricing for Medigap. But this 131 for Manhattan Life might be 135 next week or something, so it's if you're thinking, okay, I want to sit down with a licensed insurance agent next month. So I'm going to contact Sheba today or next week to get the most up-to-date quotes so I can show those quotes to the insurance agent and say, I want that one. I want that insurance company, that plan at hopefully that rate if it hasn't changed. Because when you can show up to those appointments, having done some homework, it can make a difference. I also want to show you, since we're talking about Medigaps, as I said, Sheba is not going to be the group to sign you up for a Medigap. It's going to be a licensed insurance agent. And there are some independent agents in our area that you can work with that are able to work with a bunch of different insurance companies. So you aren't necessarily going to a Manhattan Life person who can only sign you up for Manhattan Life. So let me show you how to find those. So go to shiba.oregon.gov. That's SHIBA.oregon.gov. And then you can click under this Medicare Help banner, Medicare Help near you. From there, you can use this Find Local Help tool. I'd enter in zip code 97477. I'm looking for help with Medicare agents. And if you'd like to filter by language, that can be helpful too. And then it'll pull up a map and a list of agents who you can call, set up an appointment with. And so, like I said, they're independent. They can work with a bunch of different insurance companies. They're a really good resource for a lot of the same questions you'd ask Sheba for. So if we're not able to help you on the timeline that you want, this is another good resource aside from Sheba. Great. Any other kind of general questions that you'd like to cover for now? I could do a little bit of a demonstration of Medicare.gov to search for maybe some prescription drug plans. That would be helpful. So yeah, let's say that you're turning 65, January 15th. You're thinking, maybe you're thinking, I want to go with original Medicare, Part A and B. I need a prescription drug plan. Let's see how you would go about that. You go to Medicare.gov, go to Find Health and Drug Plans and Find Plans Now. I should preface this by saying, if you make an account on Medicare.gov, first of all, it's a .gov. It's a safe place to put your Medicare number. And if you do that, you can save things like your prescription drug list, your preferred pharmacies, things like that, your current plans in your profile so you don't have to redo it every time, which can be really, really useful when it comes to an enrollment period where you're thinking, I want to compare my plan now with a new plan. So if you have your Medicare number and you want to make an account, that can save you and your Sheba person a lot of time. But because we're making somebody up right now, we're just going to go without logging in as kind of an anonymous person. So 97477, we're going to look at a Part D drug plan and click Find Plans. Are you able to see this okay? Okay. From here, you say, do you get help with your costs from one of these programs? Medicaid, Supplemental Security, Medicare Savings Program, Extra Help. So this would be that program where you make less than $1,600 or so for a single person. And they bring that cost of prescription significantly down. If you have that program, if you're eligible for it, and you say, yes, I have it, it'll bake those calculations into your prescription drug plan costs and make those price estimates a lot easier for you. For this fictional person, let's just say I don't get help from any of these programs and click next. Yes, we want to see our drug costs when we compare plans. That's the point of doing this. Okay, and so now we're going to add in our prescription drugs, the strength and the frequency so that they can give us a good estimate of our drug costs. And I will just add in some stuff. How about amlodipine? It's a common one that I see. Let's say we do a 10 milligram tablet once a day, so we get refills at 30 a month. Let's do celecoxib, why not? Let's say we take 200 milligram capsules every day, so 60 a month. And let's say bupropion. Actually, no. I want to show you something. Let's say this person takes Migdal, which is a brand name drug. You enter that in, it says add drug, and then it says, oh, hey, this comes in a generic version called lamotrigine that may cost less. And you're thinking, ah, yes, I'm familiar with the brand name drug, but I do actually take the generic. It's really nice that it tells you what the generic version is, so it can catch that and make it less expensive for you, potentially because you're entering a generic instead of a brand name. So wanted to show you that that is a thing. And let's say you're doing, let's say you're doing one a day of the 200 milligram tablets, so 30 a month. Cool. We have 3 generic drugs that we've entered. We can double check. Yep, that's what we entered. And then we can say we're done adding drugs. Now you can choose some pharmacies. So different drug plans have kind of sweetheart deals with different pharmacies or preferred pharmacies where rates can be less expensive. So I would always say choose a few different pharmacies that you're comfortable going to just to see where you can save some money. Mail order pharmacy is often cheapest of all. The reason you might not do mail order pharmacy is if you live in a neighborhood where packages get stolen or you have prescriptions that need to be refrigerated. And refrigerated drugs can be sent by mail. It's just then you have a lot of styrofoam packaging you need to deal with later on. So pros and cons to mail order. And then let's say this person likes Fred Meyer and Safeway and Walgreens as well. So we're comparing 4 different pharmacies. Who can get us the best prices? Great question. All right, so from here, it'll spit out a list of all of the 20 plans that are available in Lane County. And it automatically starts sorting by the lowest drug and premium cost that you can expect over the course of the next year. I haven't really found a reason to sort any other way, but you can just sort by deductible and premium. But I haven't found a reason to do that. So that's why I kind of leave it as is. For this person who takes those 3 drugs and doesn't have any other savings programs, this is the least expensive option. Humana Walmart Value RX plan, you're going to be paying $35.20 a month. And then you have a $545 deductible. And your total drug and premium cost for 2024 is going to be $446.40. Let's look at those details. So as you can see, this plan does not like Fred Meyer. It's in network, but it's not preferred, and so it has a lot more expensive drugs. Same with Walgreens, but mail order is going to be the least expensive, also tied with Safeway. Now I'm curious because this is Humana Walmart value, so I wonder whether Walmart is going to be the best of all. Let's change our pharmacies and find out. So it says estimated drug cost for 2024. Mail order and Safeway are $24. We scroll down and find Walmart, it's also 24. So there is the information. Now you have it. So then if you're thinking, I really want a Medicare Advantage plan, you can switch over and see 40 available Medicare Advantage plans and see whether drug and premiums are less with the cheapest Medicare Advantage plan. Looks like this Atrio plan covers all of your drugs entirely. Wow. Same with Moda and Regents is also going to be less. But if you're thinking, I really don't want a Medicare Advantage plan, then don't think about that. If you think I really do want a Medicare Advantage plan, then you have additional options. So from there, we can do plan comparisons. We can talk to you about pros and cons, what's going to be best for your budget, your lifestyle, your needs, etc. And then kind of help you come to a decision, empower you to make a decision for yourself, really, is the name of the game here. So yeah, that's a little Medicare.gov demonstration. Anything else you would like to see with Medicare.gov maybe? There are a lot of really good resources on here. You can look at the Medicare and You handbook that got mailed out. If you misplaced that or you want to see a digital version or use the search function, love that. Or you can just search for any old information you want. For example, I need a cane. Is a cane covered? You can just search for cane and see what comes up. Walking cane coverage. Here are your costs. Medicare Part B covers as durable medical equipment. You pay 20% of the Medicare approved amount. Where to get covered durable Medicare equipment items. Here's your zip code and the equipment you need, and here's where to get that information. So it can be a really great tool for finding out more about using those Medicare benefits. So that's just an example. I see a question.
Can you switch up to, like telehealth and see a comparison of your pathways?
Yeah, so question is, can we search for telehealth and see a comparison of the pathways? What I would do, yes, I can search for telehealth. We'll start there. And what it's going to tell us is what telehealth is covered by Medicare. It's not going to tell you about Medicare Advantage plans. So telehealth insurance coverage, yes, a whole article. After you pay the Part B deductible, you pay 20% of the Medicare approved amount. And what is telehealth? What counts as telehealth? And then it'll say Medicare Advantage plans and some providers may offer more telehealth benefits than original Medicare. Check with your plan to find out what benefits they offer. And like I said, if you're interested in talking about Medicare Advantage, what we've done at the Lane County Sheba office, we saw that there were 40 plans available in Lane County. We found all of the summaries of benefits and organized them into a chart side by side by side. So there's a row that says telehealth, and you can see all of the telehealth benefits for all the Medicare Advantage plans. So if Medicare Advantage is the route that you want to take, we can evaluate all of the telehealth benefits for you. Actually, I think I have that.
Side is on, she did not.
No, it's a spreadsheet that we at Lane County have made, and I have some copies with me, I believe. If you'd like to go home with one. Thank you for bringing that up because yeah, that's a pretty good resource for those interested in Medicare Advantage. And if you're listening to this online later on, definitely talk to your local Sheba office to see if they have any resources like that. Any other questions? Okay, in that case, I'm going to go ahead and end the recording. Thank you for tuning into this Sheba presentation. And please get in touch with your state or local Sheba office with any other questions. Have a good day.